Welcome back to AM Kentucky. Joining us now is Dr. Sarath. There we go. I just said it correctly. Oh my goodness. Palacadetti. Yes, there we go.
Everyone calls me Dr. P.
Dr. P. Thank you for that.
That works.
Dr. P is here with us, and he's a comprehensive breast and cosmetic surgeon with Graves Gilbert Clinic. And the reason he is here is because we're going to talk about its World Breast Cancer Research Day that's coming up on Monday. Thank you for being here.
Thank you. It's good to be here.
Well, let's talk about Breast Cancer Research Day. Tell me a little bit about that, and I know we have a month for it, but what's significant about the day?
Well, and you touched on it perfectly. So we do have the month of October that is Breast Cancer Awareness Month. But the significance of August, and specifically August 18th, is 1 in 8 women, the number 8 is significant, 1 in 8 women at some point in time in their lives are going to get breast cancer. And so it's significant.
That's
so we
scary.
choose that day to really focus on breast cancer research and what we're doing to kind of combat this disease.
And so that's where the 8th month of the year comes
Absolutely.
in. So, all right. What's new with breast cancer research?
Yeah, breast cancer research is booming. I mean, it always has been, but one of the things that we're trying to take into account is a woman's personal journey through breast cancer. So for example, the 3 things that we really are focusing on nowadays are a woman's genetics. So we can do genetic testing really early on to see what your lifetime risk of breast cancer is going to be. The second thing we do is, if unfortunately a woman is diagnosed with breast cancer, we can study not just her genetics, but the genetics of the cancer itself. And what that tells us is how risky this breast cancer is and what their chance of recurrence in their lifetime is going to be. So not just the breast cancer that they have, but the breast cancer that could come back. And so when we look at those tests, we can do that before they've even undergone a surgery. And so one of the things that it will do is it might dictate what they decide to do. There's options in breast cancer.
Yeah.
And so depending on what we call genomics of your breast cancer show, you can tailor your care. And that's where we really go with it. I think the last thing that is really cool, everyone's talking about AI nowadays. We are using AI in the world of breast radiology. So you have a mammogram, and we use AI and your patient risk score, and we're able to more accurately detect earlier if you have a breast cancer on your mammogram or not.
Oh, wow. And that's so important.
Absolutely.
With surviving it and getting rid of it.
It sure is.
Okay, so with you all, and you in particular, and I'm sure there's other doctors, you can care from the time of diagnosis to the end, reconstruction.
Absolutely. One of the big things that I like to focus on, and we at Graves Gilbert like to focus on, is comprehensive care. So when I take care of a woman with breast disease, breast cancer, I like to call myself a comprehensive breast surgeon. And so I can take care of a woman from the diagnosis. They come to my office with a funny mammogram. I can do a biopsy right there in the office and take them through the journey of their oncologic surgery, whether that's what we call breast conserving therapy, where we just take a piece of we take the cancer itself out and a rim of healthy tissue, or even a mastectomy with a reconstruction. One of the things in breast cancer that we see a lot of is that patients are seeing a ton of different doctors. You're seeing your primary care doctor, your OBGYN. If I can take a couple of those people out and just be, the end all be all from your diagnosis all the way through reconstruction, that's what I went into medicine for.
Yeah, and just take some of the, the worry off your plate. You're seeing one person. And real quick, what are some of the steps that women can take to reduce their chance of getting breast cancer? That's
a great question. I love that question. I think first and foremost, make sure you're having that conversation with your doctor, your primary care physician, your OBGYN. I'll say that the OBGYNs at Graves Gilbert are fantastic about risk assessing patients very early. We do something called a Tyrer-Cuzick score, and we're actually risk assessing women at the age of 35. And so having that conversation early, being aware of it early, potentially if you have a family history, doing some genetic testing, that's really important. So prevention in the way of screening, that's really important. The second thing is kind of lifestyle changes. What we're starting to find is there are some things, specifically lifestyle changes after the age of 40. So the more body fat percentage you have after the age of 40, fat kind of holds on to estrogen. And so the more estrogen that is exposed in the body, the more risk of a breast cancer in the future. The other thing that a study has shown is alcohol consumption. Even a small amount after the age of 40 can increase your risk for breast cancer. Now, I'm not a teetotaler by any means. I enjoy a margarita myself. However, if you are at increased risk, it's something to think about.
All right. Well, Dr. Pelicadetti got it right there. Thank you so much for your time. And breast, say it for me. It's World Breast Cancer Research Day.
Yes,
okay. There we go. That is on Monday. And if you want more information about Dr. P and what he does, you can go to gravesgilbertclinic.com or worldbreastcancerresearchday.org. It's all there. And maybe call your doctor on Monday, ask some questions about that. We'll be right back.
Thank you.